Hey everyone, it's Dr. Ty with East Valley Chiropractic. Wanted to get on here and kind of go back to the basics with you guys. We use the term subluxation a lot, both when we're talking about the spine and going over x-rays with anybody, or you may see that term a lot in some of our blog posts or in our videos. And so like I said, we wanted to go back to the basics and really just explain to you what a subluxation is. So a subluxation in its simplest form is a misalignment of the spine. What that subluxation then does is causes inflammation locally. It can compress and irritate nerves and cause muscle tension, tightness, and fatigue. And so I've got my spine here. So very commonly what we should see as far as positioning of your spine is from the front, it should be straight. From the side, there should be a curve in the neck, opposite curve in the mid-back, and then the opposite curve in the low back. So one way that a subluxation can form is in the positioning of the spine. So from the front, you can gain a curve. Most of us know that as scoliosis. That is a form of subluxation. What can happen from the side is you can start to lose the curve, so the neck can straighten out, mid-back or low back can straighten out. Hips can also move. But then the third way that you can have a subluxation is each individual bone within the spine misaligns or moves out of alignment, puts pressure and irritation on that nerve, not only locally, but also whatever that nerve travels to. So this is one of the main reasons why majority of the time we take x-rays with you, so that way we can specifically see position-wise, what does the spine look like? How is it altered or changed away from normal? But then that's why we also do those additional 2 x-rays of the motion study with the neck looking from the side and going forward and backwards, and from the low back from the front bending each direction so that we can see the functionality and the movement of the spine. When we see that movement or the functionality lost, that tells us that there's a subluxation in there, and that's the area that we need to focus in on. So in its simplest form, that's what it is. That's how we determine it, how we detect it, and obviously fixing it through the adjustment. So if you have any questions, just let us know. Otherwise, we'll talk to you soon.